It's the guys at brunch. Guys at brunch. Guys. It's the guys at brunch.
Welcome to Guys at Brunch. I'm Sean Bradley.
And I'm Nicholas. And this segment today will be about PrEP, and we invited the medical professional on to tell us some information about PrEP. So thank you, Chris, for joining us.
Thank you.
So what exactly is PrEP?
So PrEP, the acronym PrEP is pre-exposure prophylaxis for HIV. So it's the form of a biomedical intervention to prevent someone risk of exposure for acquiring HIV infection. It's the same form of method is used as birth control, also such as if someone goes to one of the African countries and are at risk for acquiring malaria, they take medications before going to Africa to prevent their risk of acquiring malaria.
Okay, so this is not to be confused with PEP.
Not post-exposure prophylaxis, which is a whole nother protocol.
Right. Is it the same medicine?
Well, one of the medicines that's used in PrEP is a part of the combination used in post-exposure prophylaxis.
Okay, so who would be a good candidate for PrEP?
So a typical candidate, initial trials when it was approved in July 2012.
Mm-hmm.
So clinical trials was done in men who had sex with men, which led to its approval for the indication for those who are at risk. So also for those who are in what's called serial discordant relationships, where one person is HIV positive and the other person is HIV negative. And this is with men who have sex with men, but also in heterosexuals. And then also the interim guidance was updated through another trial that was done in Thailand for those who are IV drug users who are at risk for acquiring HIV infection as well.
So if your partner is positive, and so if my partner positive and I'm negative, I would probably be a good candidate
You'll
for
be
it.
a good candidate.
What if he is, like a lot of people say, undetected? What if he's detectable? So would I still be a good candidate for it? And would that?
So there's a difference between if someone is detectable and non-detectable,
Mm-hmm.
which is also correlates with they may say less than 20 copies based on what sensitivity the lab is doing the test. So there's less than 20, less than 40, non-detectable. So that just means that the virus is suppressed because of medication. But if someone has a detectable viral load, there will be some numeric value, which just particularly means that they are making virus, and that's just an indication that they may not be taking their medications correctly,
Mm-hmm.
or the medications may not be working for them no longer, or they're just not on medication.
Right. I see a lot of people say I'm undetectable, but if someone is undetectable, if my partner is undetectable, should I still get on PrEP though? Like if he undetectable, if we have sex, I got a low chance of catching it.
So
HIV.
that's where the controversy comes in.
Okay, yeah, because I was confused about that.
There's been studies, one which is called the HIV Prevention Trials Network,
Mm-hmm.
which was done in Africa, where there was one group of persons who received HIV medicines for HIV,
Mm-hmm.
and everyone had CD4 counts between 350 and 500 copies. But those who, so half of them got medicines and the other half didn't. They was only offered medicine until their CD4 count dropped below 200. And this showed that there was a 96% efficacy in those persons who were placed on medications. So they had a 96% decreased risk of transmitting an HIV virus to their partner. So this is where that whole concept is treatment is prevention comes into play. So my thing about my caveat about if your partner is non-detectable and if you should be on PrEP, you only can be accountable for yourself and know that you take medicines to suppress your viral load. You can't account for your partner's actions or vice versa. So everyone is not fully committed or monogamous, so they could still be at risk for acquiring HIV. And also, you can account for your partner's monogamy as well, and they can also acquire a different strain of HIV infection and then pass that on to you.
So basically, with using PrEP, you still want to have safe sex as well, too. Basically, it's not saying I am on PrEP, so I'm protected from HIV.
Right. Correct.
So you still want to use condoms?
Correct. Yeah.
Okay. Do you think PrEP send a mixed message?
For many, it has been a mixed message, and I think it kind of put people back into the 80s or such, when people didn't care particularly to use condoms, and but
Mm-hmm.
there's also been studies that shown that those who've gotten on PrEP, because PrEP is just not giving someone a pill, it's a program. It should be a program, because it requires follow-up every 3 months for screening for HIV. So also with that is harm reduction counseling as well, where you talk about condom uses, and then you are doing an assessment to see how many partners someone is sleeping with as well. So there's been studies that show that this follow-up every 3 months create some sort of self-awareness for the individual, and they've actually had a decrease in partners since being on PrEP.
So what if you're like single and you know you're kind of promiscuous when you're single or whatever? Would that person be a candidate for PrEP? I mean, even if they are using protection, but can they say, hey, I want to get PrEP just in case, because I might go to the sex party tomorrow night and there might be 10 guys I might want to get with. So should I be a person that want to take that medication?
You should be a candidate for PrEP. And that's just real talk. We live in a day and time where there are apps that make the chase much easier, where, okay, if it is what it is, you can meet and greet, get to it, bam, that's it. You know nothing about this person's history, just like you go to a sex party. You know nothing about these individuals that are there that you're going to have sex with. So you want to arm yourself, and PrEP is something you can arm yourself with.
Now, PrEP doesn't, let's say for instance, so if you do have unprotected sex and you have PrEP in your system, it's not 100% guarantee, right? What is the percentage?
It's not. So the initial studies when this was approved, so one was called the IPREX trial, which was done in men who have sex with men. So the overall efficacy was 44%, but that efficacy rate increased to 90% when they were able to draw blood and find that these persons had detectable medication levels within their blood. So this is why it's important to take it consistently.
Okay.
How many pills do you have to take?
It's one pill.
One pill,
A
like
day?
daily?
Just one pill a day.
Okay. And what about, I know like people say, well, like when you take medication, it damage your liver. Like,
Well, no, so depending on what type of medication it is, there's always some sort of a risk of a possible side effect. So even before I start someone on PrEP, we do liver functions tests. We do renal functions tests. So we testing to see if their kidney functions are within normal range. Also, their liver functions is within normal range. So, and then we have them follow up in a month and repeat those tests to make sure those levels are still within normal limits.
okay, what about building up a resistance to it?
So the only way that someone will build resistance to the medicine is, in fact, if they do become HIV infected. And if they do become HIV infected, then more than likely they will not take the medicine every day, and they acquired infection, and that medicine Truvada is not a full, complete regimen to treat HIV. It's part of a regimen because any individual that's being treated for HIV should be on 3 highly active antiretrovirals. PrEP only consists of 2 medications, not 3. So this is how someone can build resistance. And this is why the intense follow-up every 3 months is important to be screened.
Before you prescribe PrEP for someone, is it mandatory that they get tested to make sure they're negative so they won't build the resistance in case they was positive?
Yes, it is. But there's more of an intense screening to some degree. So if someone came in and they think they might have a high-risk event, then you have to make the clinical decision, okay, is this person a candidate for PrEP, pre-exposure prophylaxis, or PEP, post-exposure prophylaxis? And if you were concerned that someone may be in what's called the acute phase of HIV infection, then you will want to rule that out before starting PrEP, because that's how we could place a person at risk for resistance.
Right.
In fact, if we did start them on PrEP and they was in the acute HIV phase.
So the PEP is like is identical with the HIV medicine. Like if someone's HIV positive, all the ingredients are in PEP.
Right. So post-exposure prophylaxis, if someone felt they have had not one high-risk event, but a high-risk event, whether it be with a partner who's positive and they said the condom may have broke, or maybe they went to a sex party and it was unprotected sex and they felt that, okay, they were at risk, they could go to possibly their primary care provider or the emergency department, express this, what may have occurred, and they should be prescribed post-exposure prophylaxis. And the post-exposure prophylaxis regimen is one of the medicines which is called Icentris, which is from a class called integrase inhibitors, also Truvada. And that's taken for 28 days, but this event had to happen within 72 hours.
So even still, this only got 2 ingredients from like if you was HIV positive.
No, the medicine is a total of 3.
Oh, okay.
3 active agents.
Okay. And I asked that question because I know someone who's real frugal and they have a friend that's HIV positive. So when he don't take all his medicine as prescribed and he have leftover medication, he get them and he want to stack up like 28. So in case he have a slip up, even though he used condoms, if he have a slip up, he want to take that HIV medication for like PrEP. I mean PEP.
PEP.
Yeah, so that's why I asked that, and I was
Well, I wouldn't recommend that.
Right.
That's a little off label.
Yeah, that is risky. I bet
It's risky for both because whoever this friend is isn't taking his medicine every day because there's no way he should be having leftover medications.
Wow.
So he's at risk for resistance and transmitting resistant virus to his partner or whomever. So, you know, that's both sides of the
Right.
Now, when you say like you was asking about the mixed messages, whatever, I think if it's a mixed message, it's because the person that's saying, oh, there's PrEP out there, so it's going to protect me from HIV. It's because they want to see it that way, as in saying, if I just take this pill, I don't have to necessarily have protected sex, and I can be a little bit more promiscuous than beforehand. Because I think you guys have done a good job saying this is not saying, hey, this is a cure-all. It's just saying this is to help prevent. So I think that's where the mixed message comes from, the person that wants to do it.
And I feel strongly that this is important because there's something called the continuum care cascade, also known as the Gardner cascade, where there's roughly about 1.2 million people who have HIV, but of those 1.2 million, only roughly about almost 900,000 know they are infected. And of those 900,000, only about 30% of those have a non-detectable viral load. So we have roughly about anywhere between 600, 700,000 people who do not have a non-detectable viral load who's at risk for transmitting virus to someone else. So we don't have a vaccine right now. So PrEP is, part of the answer to decrease someone's risk of acquiring HIV infection if they're HIV negative. Because annual incidence does not change every year. There's still anywhere between 40 and 50,000 people being infected every year since the epidemic started.
Right. Why do you think PrEP is so underpromoted? Like a lot of people don't know about PrEP.
They don't. Part of it could be from the pharmaceutical standpoint as well, in terms of advertisement. Depending on where their efforts are, I think you'll see a change in how PrEP will be, promoted within this next year, especially from the makers of Truvada.
Okay, so we might start seeing that like on like the bus ads and things like that.
Maybe, but you gotta. So I think also the difference is depending geographically where you're located. Like San Francisco compared to New York to Baltimore to DC has a different vested interest in what's going on in their communities in terms of HIV infection.
Okay, all right, we're gonna take a quick break and we'll be right back.
Do you have a business, product, or event that you need to promote to men and women ages 23 to 44? If so, Radio on Fire can help you do it with one of our promo packages. Our broadcasts reach over 150,000 people per month. Sponsorship for one or all of our radio programs can include live mentions, social media posting, commercials, and more. Visit radioonfire.com/advertise to find out more about a promo package that fits your needs. Rates start as low as $50. If you want to reach men and women ages 23 to 44, log on now, radioonfire.com.
All right, so now we got some questions that some people might just have, like, and they too bashful to ask their doctor. So can HIV be transmitted through pre-cum?
It can be. So there's been, although some people may have a non-detectable viral load, but there's been some research that's shown that there can be some virus in vaginal secretions and also in pre-cum as well.
Okay. And I heard that if you, like, swallow, if you're given oral sex and you swallow your partner's cum, that the acid in your stomach will kill a virus, so you can't really get it like that. Is that true?
Okay, totally false.
Okay.
So my thing is, especially when I'm teaching about how HIV is transmitted, I say you want to protect your pink parts. So pink parts being your mouth is pink inside, under your eyelids is pink, your rectum is pink in the inside, and also inside the head of the penis is pink. So these are all forms of the way that HIV can be transmitted. So if something is going into your mouth, your mouth is already exposed. Especially if, they could be something called micro tears. You may not see those tears, but they could be present. So if something has to go all the way down through your esophagus, you're thinking that this is where oxygen may exchange and all that. So that's totally false. Yeah.
Okay. So that's kind of saying like if someone was to get a facial and they got in their eyes, that
could be a route of transmission as well.
And it would just be absorbed through the pink parts, without even a tear. Just
yeah.
Wow. Okay.
Just think some medications like eye drops.
Yeah.
So those are absorbed.
Okay.
Mhm.
I was reading online and I came across this, and you kind of just answered it, but someone said that if you swallowing is more safe than spitting, because if you spit, then like if you do got a cut in your mouth, you know, you putting yourself at more risk because it might enter the cuts as you spitting out.
I just think
So-
overall, do not let anyone ejaculate in your mouth.
Okay.
Okay.
Mhm.
You, if anything, you may want it on your cheek or something. But no,
Not on, not above the
It's
neck.
Not on the pink part.
Not
your
above
skin
the
is a
neck.
barrier. Your hand on all this is your skin is barrier.
Okay, so not on the pink part.
No.
All right, well, thank you for answering our questions about that. We
Okay.
appreciate it.
No
So,
problem.
our next topic is the Monique thing.
All right, so basically, you all probably aware now that Monique wrote an article saying that she was blackballed, and that Lee Daniels is the one that told her that she was blackballed from Hollywood because she didn't play the game. And what they meant by playing the game was is that when she was nominated for the Oscar, she refused to go and promote the movie Precious. She wanted to be paid for Precious. She wanted to be paid for every red carpet that she attended, and she was like, that's not in my contract, I'm not doing it. And most actors, when they're in a movie, especially if it has Oscar buzz, they're going to be everywhere saying, hey, go see the movie. And what I don't understand is black folks, we rarely get a movie. You know, we might get maybe 1 or 2 movies a year, basically, if that. And so, like, and this was a good movie. People going to see it, spend the money to go see it. So why not say, hey, get out there and maximize the impact of that movie and say, go see it and make more money and show people that, hey, black movies can make money so we can have more black movies. So I don't see why she didn't want to do that. But they were saying her husband was part of the reason as well, too, because this guy came out with an article they saying that her husband cussed him out when he worked for BET, and they were trying to do something for her.
This kind of remind me of that Kevin Hart thing, like when Kevin Hart wouldn't promote, like you know, use his social media
Okay, yeah.
to promote a movie he was in, and maybe it's not in their contract, so they feel like if it's not in my contract, I'm not doing no extra promotion. I already did the movie, it's done, so why should I have to do extra if it's not in my contract? If I do any extra, then I want to get paid for it. Mm. But Monique has, you know, it's been she's legendary for having a nasty attitude. You know, I've heard that. A lot of people say like, you know, she's nasty to like people behind the scenes. So maybe that has something to do with
And
it.
her and Oprah got into it too. They, you know, her and Oprah got into it and had a falling out. So I mean, hell, that's the wrong person to really go against.
I just wonder if there's any room for possible renegotiation within your contract if you're asked to do more, especially if you're considering you want to be paid for it. But I would think that if you take a role, then you should stand by your role, and you should, I mean, because you want to be acknowledged for your role, and you want people to see you in that role. So I mean, you know.
I think they do want to be acknowledged for that role, but I think that the companies behind the movie is making a ton of money more than the actor and the people in front of the camera. So I think sometimes they feel like you getting all this money off of me, so you know I'm gonna cash in on myself also.
I think it gets you get too big for your britches at one point in time, because most actors, if they're in a movie, they're going to go out there and they're going to promote it. I don't think most promotions are in your contract anyway. It's like, hey, we got to go to Comic-Con for, you know, Fantastic Four or whatever it is, Avengers. You know, we got to go do that, show, meet and greet, meet people, make sure they come out and see our movie and support us, because the more people that come, the more my bargaining power is going to be next time when I go sign my contract for, I want to do this movie. Okay, well, we made this much money with me in it. Now I want $10 million more or something. You know, eventually we can get to the point where black actors, hopefully, but
And your fans want to see you.
Yeah.
I mean, you don't want to let down your fans overall.
because they canceled her show from BET. Everything was she was just kaput. And I was like, why is her show leaving BET when it was a popular show from what I was seeing? But
Right. And she also said that the role in The Butler was supposed to be hers, but it went to Oprah.
and she's supposed to be in Empire as well too.
Right.
'Cause-
So I mean, maybe and when you said her husband, I also read that her husband would go behind her back and ask for more money, and
But
Yeah.
is she remarried? Cause didn't
Yeah, she married the
okay.
guy from her classmate, some guy from Baltimore, and he looked like, if you see him like in the pictures, or whatever, he looks like one of them slick fools that like, baby, you own, you get more money. He's one of them type that don't know how to play the game, basically. And it's like, just by reading the article, what the guy said, how he dealt with him. The man called and cussed him out and everything, and he was like, who wants to deal with that? So he was like, if she comes back and get another chance, hopefully they both have a better attitude, and she gets a real manager and somebody to handle that situation, keep her husband in the background.
Right.
Right.
So was that in Empire? Was her role supposed to be Gabby?
I don't think it's supposed to be. Oh, maybe.
That's what I was thinking.
But okay, let's talk about Gavin. Can we talk about Gabby and why ain't nobody pulled her to the side yet and said, "Look, girl, call Jenna Craig, Weight Watchers, get a Jennifer Hudson deal or something."
Well,
You
she's
ain't
working.
She working. I get it, but I
And
mean,
she's
it's-
beautiful. If she feel beautiful, she should. But before we move off of Monique, I wanted to say that, do you think Monique was known to be the fat girl, the fat ghetto girl in the movies? And when she went on whatever weight loss program she went on, that they was like, we don't want to use you anymore.
Well, she was blackballed before. I mean, she only really just started going hard for the weight
But
thing.
once she lost the weight, I don't think, did she do anything once she lost
No,
the
she
weight
was a fat
besides
girl.
her show?
She was a fat girl in Precious, and after Precious,
I know,
she
but
got
I'm saying
blackballed.
that's what I'm saying. After she lost the weight, it seemed like she disappeared from Hollywood to me.
'Cause
So I'm saying maybe that was her type role that Hollywood saw her as
I
a
see
fat
what you're
black
saying.
girl, and maybe once she lost some of the weight, they was like, we don't see you as
Well, she's
even
still-
trying to be pretty.
well, she's still
in
a big
Hollywood
girl.
eyes.
Yeah,
I know she's still a big girl,
she's
but
still a
I'm
big
just saying
girl.
that's something that crossed my mind.
Still a
But,
victim.
but you think Gabby need?
I mean, when the stuff that they put her in, and it's like, and them arms, it's like, girl, I just want somebody to talk to you, because if she sits down and dies off a ham sandwich a year from now, everybody gonna be crying saying I shoulda, coulda, woulda. So is there anybody saying, girl, you ain't gotta lose all of it, but maybe a good 50 pounds for the start. Let's just lose a 50 pounds, to breathe a little bit better.
Well, I mean, I would think her quality of life is better now. So hopefully she's making better decisions.
She ain't making no better decisions. She getting bigger.
She
eating
may
better.
have that fat gene that just she can't help. I mean, I wonder what her mother and father look like.
But look
you
at E.J. Johnson though. He
had-
went and got a lap band.
Okay,
And
so-
in like 3 months, I'm like, damn. I mean, she got the funds to do that. So if she does have a fat gene, there's ways to control it in a sense. But I don't think
Maybe
she.
she might not want the possible risk or complications
true.
that come with having a lap band procedure or a partial stomach.
I just want to know her mindset. I just want to know her mindset.
She might be fine with how she
She
looks.
seems very happy.
Yeah.
She seems very happy. That's why I said I want to know her mindset and how she feels about her weight. I mean, she seems to be comfortable with it, but I don't know.
I think she
This
must
is hard
be
on the
fine.
I
eyes.
think she stepped it up some actually.
Because that was his
She-
picture.
I mean, although she's not styling herself on the show, but she's taking risks.
That
With
wig,
blonde hair.
that wig is horrible.
Right.
That. Okay, Gab, make your money, baby.
When she went to that concert, she was, she was hanging.
So we good?
Yeah, I think she fine though. Yeah.
Okay. Well, thank you guys for joining us. That was our show. And Chris, thank you for the education that you've given
No
us.
problem, anytime.
All right, and if you want to find us, make sure you check out radioonfire.com. Find us on Facebook at Guys at Brunch, on Twitter, Guys at Brunch, on Instagram, Guys at Brunch, YouTube, Guys at Brunch.
Yep. That's it.
And if anyone has wants any information regarding PrEP or how to receive PrEP services, please email these guys at Brunch, and they will get the information to you.
Right.
Through me, I'll give it to them to give you.
All right.
Right. All right. Until next time.
Bye.
Thanks.
Nope.
So behind the scenes, after we ended the show, I thought of some questions that I meant to ask, and the question I asked was, if you get full-blown AIDS, as people who don't know any better, like myself, I didn't know before you told me though, but if HIV advanced to AIDS, can you get it back down and become undetected?
Okay. So regardless of what somebody's CD4 cell count is, so less than 200 is when someone is considered to have AIDS, and AIDS is just advanced HIV. HIV is the same virus that leads to AIDS, and AIDS ultimately, someone is diagnosed with AIDS ultimately when they're not on medications, and that's because their immune system is weakened. But even with a weakened immune system, once someone gets on medications, they can achieve a non-detectable viral load, which is also called viral suppression.
But they still always will be considered as AIDS.
Because
right?
they've gotten to an AIDS defining point, they will always be considered to have AIDS, although they can rebound above 200 CD4 cell count. Because it lets us know where they can possibly get back to. Like say someone has a CD4 count at 350, and they get a real bad pneumonia. So our immune system is to protect us against infection. So if someone got pneumonia, your CD4 cells will take a hit, and you can drop below 200 and still be at risk for opportunistic infections. And so you could be at risk for AIDS defining things just from an illness.
Okay. So I know far as like ethic codes go, that you can't disclose someone's status to someone else. But say if someone came in with their partner and their partner tested positive, and the other partner tested negative, can you tell them then?
We can't tell
No.
anything to the partner that's negative. That partner who's positive has a choice to either disclose that to his partner or not. But there's also Baltimore City Health Department that can help with that, and that's called partner notification services.
Okay.
A lawsuit.
And they have to agree if they want partner notification services involved. So partner notifications will contact those persons who may be at risk and say that you've possibly been exposed, and I think you should get tested.
Okay, I always thought that even though we have like, well, y'all follow a code of ethics, that it was also your responsibility if one is if they both are present in your office, that you had a duty to warn, and you could go above or break that
Well,
code
we
of
would
ethics.
never do a test with two people sitting like next to each other. That's personal and private and confidential. That it will be done individually.
Right, but I'm saying if it's done individual and one you bring them back separately to get their results. But if one show up negative and one show up positive, and they had sex last night, can you then warn them so you maybe can start them on PEP?
No,
Oh, no.
The Baltimore City Health Department will be notified of that person that's new. I mean, for one, if someone screens positive, like if a swab test was done, that's only testing for antibodies. You still have to do a confirmatory test, which is through blood. So even once you get the confirmatory test, then it's reported to the state and the health department. So if you feel that partner needs to be notified, then that's when partner notification services needs to get involved.
Would they try to let them know within 72 hours?
I'm not sure of the time frame, but I would think if it's something that's urgent, if a provider was concerned that was the case, and then maybe those rare. I mean, there is something where if a provider feels that, okay, there's a law that can protect the provider, that if he felt that this was something that he needed to disclose to that partner, he possibly could make that clinical decision. But with the law, not many providers are going to try to get involved if there's a service like partner notification services that will, try to track down that person.
Okay, but it's a slight possibility that they just might, if they think they
doubt
can
it,
save
but
them.
yeah, I forget
Okay.
what it's called, but there is something in the clause that will
Yeah.
protect the provider.
So how?
So I was just gonna say, I asked some of these questions, but I know the answers to some. And actually, that happened to one of my friends, and the provider had to break that confidentiality because they had sex that night before, and I'm sure he okay with me discussing this, but so they told him so that he can get started on PrEP immediately, and it saved his life.
He got post-exposure prophylaxis.
I said PrEP, I meant PEP. That's what I meant. Yeah.
Okay.
And I was gonna ask another question about the swab thing. So do you always do like a confirmation with the blood?
Confirmations with the blood, yes.
Okay. So is it sometimes that you do?
So with the swab, that's just testing for antibodies.
Right.
So if someone is acutely infected with HIV, so an acute infection will not show. So there's something called antigen and antibodies. Antibodies your body makes to fight infection, but your body doesn't recognize that this antigen, which is the HIV virus, is within the body not until like 6 weeks to 3 months out. So someone can be acutely infected and screen negative for the screening test, but actually be HIV infected.
But is it ever like I want to say like a false positive, like if you do it like in the mouth, like with the swab, is it ever someone come back positive, but when they do the blood, then it show up negative?
No, so if there was a false positive, then someone may have another immunocompromised condition or something.
Okay.
Something possibly like lupus or something like that for a false positive. But usually those are 99% accurate. Yeah.
Okay.
Okay.
But I would say we're trying to move away from the kind of only time those kind of antibody testing is usually done is like at health fairs and stuff like that. But if you're going to a primary care office to see your primary care doctor, they should just be doing routine screening, which is a blood draw, and that should be with a 4th generation antigen antibody test,
Right.
because the antigen will show up within 10 to 14 days, and that's how you would catch acute infection. Antibodies again is like 6 weeks out. But if you're truly concerned if someone is newly infected and they may have acute viral syndrome, which is like flu-like symptoms like fever, fatigue, body aches, night sweats, and all, then you would just do an HIV viral load.
Okay.
Because a viral load would show up before antigen and antibody.
Okay. Because I was just asking again, for that, like the Orquick is like popular now, so a lot of people take them. But you had a
Well,
question.
yeah, because they sell those at like Rite Aid
Mhm.
and stuff like that.
Oh, my question is, how close do you think they are to find an actual cure?
I wouldn't say close. There's still a lot of research. Like a lot of research has been put into vaccine research, but I think now a lot of efforts are now being put into cure research, especially with like the Mississippi baby and the studies that was done at Harvard and all. But unfortunately, all those persons rebounded now have had detected virus and have to be placed back on medication.
Okay.
With the exception of the Berlin guy. He's the only one who was considered a functional cure.
Well, this guy, like years ago, I want to say like in 2006, this guy named D Woods. He's a gospel singer, and we were in Atlanta at this concert, and so he sung with what's his man's name, Donald Lawrence and them. But he had his album out, and he's at the church, and he gave his testimony. He's saying that basically he was in the hospital for months, and he was diagnosed with HIV. And he was like, they prayed on him and everything. And next thing you know, he's cured of his HIV. And I'm sitting there looking like, okay. And this is in church and everything. And I'm like, oh, okay. But I'm just
And
like,
scientific evidence supports his.
I don't ask me, but that's what he claimed in front of everybody. And I'm looking like,
He was delivered.
Yeah, I have clients who feel that they are going to be delivered from this virus.
he
And-
was
and-
delivered. And let him tell it.
Let him
And I
tell
was
it.
like, oh, okay.
I have a question about Magic Johnson,
Mhm.
and is he cured? I mean,
Magic
I'm sure you
Johnson is
wouldn't know
not-
the answer to that.
I do not. But Magic Johnson has publicly said that he's on HIV medicines, and if I can't quote him, but if I recall at the time when he said this some years back, he was on a regimen called Redtas Norvir Truvada. He was on 3 active agents, and now. I mean, that was years ago when he started that regimen, but now there are better agents where he's possibly on a single tablet regimen. But he's HIV infected. He's not cured.
But he has money to, get the best of the best of the best.
But still,
right?
but we have great drug assistant programs here in Maryland that gets.
Well, I'm just
people
saying
the best
before
of the best.
the drugs were coming along, but he had the money to just kind of, I don't know. Some people he got like
Trust
a damn
me,
blood
he
transfusion
got-
machine at home, and
he
he's
got
like
enough.
cleaning his blood and stuff.
He got nothing any different from what was available to everyone else.
Right.
That's it. It's all about access.
Yeah. But I guess people are saying because he had it for so long, and and a lot of people that have gotten it
I know many
has
people
gone to
had it
pass
so
away,
long
and
still
so,
alive,
yeah,
and,
so.
yeah.
Yeah.
So basically, if you're not taking your medication, basically it's going to develop into AIDS, basically,
The
and then most likely you'll pass away.
Medication has, 2 benefits. It keeps the person healthy, and it keeps the public healthy. Again, if someone has a non-detectable viral load, they have a decreased chance of transmitting virus to someone else.
Okay.
So not only are they well, but the public as well.
So basically, undetectable just means that, hey, I'm on my medication and I'm less of a risk than somebody that's detectable.
Exactly.
Okay.
Yes.
But,
Okay.
some people might stay undetected without even just taking their medication. Is that possible?
There are a rare group of individuals, not many, and they fall in a category called elite suppressors, where in the absence of HIV medicines, they're able to achieve a non-detectable viral load. Not many of them, but still, there are studies now show that just because someone may have the infection within their body, the presence of that infection in their body, regardless of it being at a non-detectable state, there's something called inflammation, which within the body ages the body. So they still can benefit from actually being on medicines as well.
Okay, because they might be like 50, but inside they like 100.
Well, not 100, maybe like 60.
Well, damn.
Okay.
Yeah.
Cool. Well, thank you again. We appreciate all this information.
No
Thank you
problem.
so much for coming by,
Anytime.
stopping
Anytime.
by. Thank you.